Hello, welcome to the Citizen CPR Foundation's HeartSafe Community Orientation Vodcast. My name is David Hiltz, and I currently serve as the director for the Foundation's HeartSafe Community Initiative. I would like to thank you for your commitment to saving lives and for taking time to learn about our life-saving campaign. Improving survival from cardiac arrest is not complicated, but at the same time, it isn't easy. The very nature of cardiac arrest requires bystanders to be ready, willing, and able to act. Additionally, to be successful, their actions in combination with care provided by our EMS, fire, and first responder agencies must occur within a system that coordinates and integrates each facet of care into a choreographed group effort, focusing on neurologically intact survival to discharge from the hospital. The mission of the Citizen CPR Foundation is to save lives from sudden cardiac arrest by stimulating effective community, professional, and citizen action. There are three core values that form the basis for our efforts. We know emphatically that early CPR and early defibrillation can save lives. We also know that collaboration among citizens, professionals, communities, and organizations is key to survival. Lastly, action based on best practices in science, education, and implementation improves outcomes. Please have your HeartSafe community criteria available as a reference during this vodcast. It can be found on the Citizen CPR Foundation's website at this URL. This will be very helpful to you as we continue through the orientation today. During this vodcast, I will give you a guided tour of the HeartSafe concept, including specifics related to the mandatory requirements, the application process, and more. Thanks to the generous support by our industry partners, the Citizen CPR Foundation is able to provide guidance and designation to communities free of charge. Cardiac arrest can strike a seemingly healthy individual of any age, race, ethnicity, or gender at any time in any location, often without warning. Cardiac arrest is the third leading cause of death in the United States, following cancer and heart disease. 4 out of 5 cardiac arrests occur in or around the home, and more than 90% of individuals with cardiac arrest die before reaching the hospital. First and foremost, cardiac arrest treatment is a community issue. Local resources and personnel must provide appropriate, high quality care to save the life of a fellow community member. Time between onset of arrest and provision of care is fundamental, and shortening this time is one of the best ways to reduce the risk of death and disability from cardiac arrest. Our purpose is clear. We must focus on developing systems that aim to save hearts too young to die, to prevent sudden cardiac arrest from becoming sudden cardiac death. Because the vast majority of sudden cardiac arrests occur in the community, we must transform bystanders into tristanders. The HeartSafe community concept works by creating criteria that support the cardiac arrest chain of survival and encourages community to work towards them. The primary goal of HeartSafe community programs is to increase survival rates from cardiac arrest. Individual communities can develop and implement life-saving networks that focus on coordinating local resources to prevent sudden cardiac arrest from becoming sudden cardiac death. Group efforts involving individuals, businesses, public officials, and emergency responder agencies can establish a cardiac arrest response system to make the difference between life and death. Regretfully, there is no secret sauce or single intervention that will magically improve survival rates in our communities. However, there is a recipe for success that is based on available science, best practices, and emerging innovations. The Citizen CPR Foundation HeartSafe program focuses on community-wide interventions to effectively increase survival and improve outcomes from sudden cardiac arrest. Communities must be recognized as ultimate coronary care units in order to effectively increase survival and improve outcomes from sudden death. Community-wide interventions that will improve overall quality and increase the likelihood of early bystander-initiated CPR and rapid defibrillation are critical aspects of any effort to reduce death and disability from cardiac arrest. The optimal strategy is one that actively engages a community at all levels. Through the HeartSafe program, we intend to guide, empower, and enable communities to strengthen local stakeholder collaboration, encourage data collection, analysis and dissemination, facilitation and implementation of life-saving strategies, the promotion of public education and training, the improvement of delivery of high-quality resuscitation and post-arrest care, and the enhancement of the impact of cardiac arrest therapies. As part of the Citizen CPR Foundation's efforts to improve survival, a group of experienced subject matter experts were convened to examine existing program elements and create a more robust criteria to reflect current treatment recommendations from the resuscitation community, as well as newly identified best practices. This resulted in a new group of 13 robust criteria necessary for designation as HeartSafe by the Citizen CPR Foundation. Additional influence was garnered from the Institute of Medicine's strategies to improve cardiac arrest survival. The Citizen CPR Foundation has also established a HeartSafe Community Program Advisory Committee. We have strong representation from emergency medicine, emergency medical dispatch, public health, law enforcement, emergency medical services, the fire service, critical care, cardiology, and pediatrics. Each member was identified and recruited based on past and current involvement in resuscitation, as well as their demonstrated passion for improved outcomes and their respective areas of expertise. The role of the Program Advisory Committee is to assist the Foundation in operationalizing and guiding the program moving forward. Additionally, they serve as subject matter experts and, in many cases, coaches for communities that have encountered challenges in achieving the defined benchmarks needed for designation. The HeartSafe concept is based on 13 core elements. These elements are outlined in the downloaded HeartSafe criteria form that you should have in hand. Sudden cardiac arrest is a communal problem, and local issues demand local solutions. As such, a lead organization is necessary for overseeing and coordinating localized HeartSafe efforts. These lead agencies take ownership of the project and enlist help and representation from the community at large. Most often, a public safety agency or healthcare institution will assume the role of a lead agency. It is nearly impossible to improve something that isn't measured. With this in mind, the Citizen CPR Foundation calls for the community to develop a plan for the collection and analysis of cardiac arrest data. Enrollment and participation in the cardiac arrest registry to enhance survival is strongly and highly recommended. In those cases where participation in CARES is prohibited for any reason, locally developed and compatible methods are acceptable. The key is not only to collect data, but to make it the very foundation for all efforts in improving outcomes moving forward. Building on local coordination, data collection and analysis, citizen CPR education and action plays a pivotal role in improving outcomes. Ideally, our entire citizenry is adept at recognizing cardiac arrest, has some form of hands on experience, and is willing to perform CPR when called upon. Realizing the importance of tristander actions, the Foundation calls for a minimum of 15% of the community population to receive some form of CPR education on an annual basis. All forms of training are acceptable, including hands only CPR, as well as certification training at any level from any nationally recognized organization. Furthermore, views of approved ultra brief instructional videos produced by the American Heart Association and the American Red Cross can contribute to your community's 15% goal. Recognizing the actions of those who come to aid another person in their ultimate time of need can help in promoting your life saving efforts and reinforce desirable behaviors. This positive reinforcement can take on many forms, such as lapel pins, paper plaques, survivor rescuer events, and more. The key is to formally recognize all those involved for their efforts wherever and whenever possible and appropriate. Criteria 5 calls for the community to develop and implement strategies to increase public awareness of sudden cardiac arrest, the encouragement of bystander intervention, and public support for your life saving campaign. Examples include public demonstrations with hands on practice, improving access to certification courses, the utilization of social media and ultra brief instructional videos, billboards, newspaper articles, and other innovations. Let's address element number 6, telephone CPR or TCPR. Telephone guided CPR can significantly improve bystander CPR rates. In order to meet this requirement, we call for your emergency communications center or centers to have committed to providing effective TCPR in accordance with the American Heart Association telephone CPR program recommendations and performance measures. In those cases where a community does not yet have TCPR in place, the Citizen CPR Foundation requires community leaders to engage with local and state authorities to enact enabling regulations to support TCPR. The American Heart Association and American Red Cross are likely partners in any efforts to get TCPR legislation on the priority list in your geography. Criteria 7 calls for schools and municipal buildings to have effective emergency response plans for cardiac arrest. In addition to having a well thought out plan, we encourage periodic drilling as a means to identify best practices and areas needing improvement. Schools and municipal buildings have fire and other drills as a matter of routine. Why not do the same for sudden cardiac arrest? Element number 8 addresses the permanent placement of AEDs in public or private congregate areas where there is a statistical likelihood of sudden cardiac arrest, such as shopping malls, supermarkets, theaters, health clubs, parks, recreation and transportation centers, as well as other venues. Additionally, the Citizen CPR Foundation recommends that AEDs placed at athletic fields, parks, beaches, and public gathering spots should be accessible on a 24/7 basis whenever possible. There now exists a variety of purpose built products that enable AEDs to be kept in secure outdoor environments, making them more accessible to greater numbers of people. Automated external defibrillators are proven lifesavers. In an effort to enable their utilization, Element 9 requires the community to establish or participate in an AED registry where AED locations are mapped and integrated with the 911 system and or local public safety answering point. Integration of this data with 911 is essential. By doing so, bystanders can be directed to nearby and accessible AEDs by emergency telecommunicators, reducing time to first shock. In many communities, equipping and enabling first responders, such as police officers and firefighters, can significantly reduce time to first compressions and first shock. Accordingly, Element 10 requires first responder agencies to be defibrillation capable, undergo appropriate training, have device maintenance plans, dispatch policies, event debriefing, and active medical direction. High performance CPR can boost survival outcomes significantly by ensuring that victims receive enough blood to their heart and brain during resuscitation. High performance or high quality CPR is an expectation for all those who are responsible for the delivery of professional resuscitation. Recognizing the value of high performance CPR, the Citizen CPR Foundation requires the local emergency medical services provider to practice high performance CPR and possess supportive protocols, technology, and equipment for resuscitation and post resuscitation care. Further to Element 2, data collection and analysis, Criteria 12 requires the local EMS provider agency to have effective quality improvement processes for cardiac arrest data review, facilitated debriefing, access to patient outcome data, and active medical direction. Additionally, this criteria calls for the lead agency to periodically and publicly share cardiac arrest performance data. The goal here is to measure and improve, as well as provide transparency and improve the support from your community. The adage, an ounce of prevention is worth a pound of cure, is reflected in Criteria 13. This element addresses the requirement for communities to have established primary and secondary public health measures that support cardiovascular wellness, such as education, prevention, and systems of care for stroke and myocardial infarction. The application process begins with an online submission on the Citizen CPR Foundation website. Applicants use an online form that enables answering specific questions along with uploading supporting documentation such as rosters and related files in a digital format. A quick word about process. Improving cardiac arrest outcomes is a process requiring a host of interventions and ongoing measurement. As such, it is truly iterative, and this is expected. You will need to repeat your processes uh, repeatedly in many cases in order for you to reach your goals. In getting started, I can't overstate the value of teamwork. And in that spirit, I recommend collecting a core team early in your campaign. Individual advocates will find that progress will be difficult in the absence of a team and will likely be unsustainable. When assembling your team, it makes sense to build a diverse group of dedicated individuals who accurately reflect the makeup of your community. Don't limit yourselves to a team comprised of only healthcare providers. Ultimately, your success will require talents and efforts from a variety of leaders and influencers in your community. Once you have your core team assembled, the next step is to perform an inventory or assessment of your community. Evaluate your current state in regards to the 13 criteria. Where are you doing well? What areas need improvement? Where is there an absence of supporting data? Your assessment will provide you with the information you need in order to carry out next steps. In addition, this assessment often yields opportunities for dialogue between important groups in your community. Once your core team has completed the preliminary assessment of your community, it is likely that you will have identified areas where you have gaps or unanswered questions. These gaps and unanswered questions are best used to form the basis for your strategies and plans moving forward. Your strategies, tactics, and goals should be well defined and achievable. With your strategies, tactics, and goals now defined, put them into motion. Action changes things. Be steadfast in your desire for progress and change, but realistic in setting timelines for achievement of goals. Depending on your assessment and plans, some goals may be short term, while others may take longer to achieve. Take small incremental steps wherever and whenever appropriate and possible. The next steps in your iterative process will be to assess the effect of your intervention or interventions. Reassess your current state in regards to the 13 criteria. Where were you able to observe success? What areas do you need additional improvement? Do any of your strategies and tactics require retooling? Additional work is likely needed on an ongoing basis. Furthermore, you may have identified new supporters, opportunities, and strengths in your community and system. This assess, plan, intervene, and reassess cycle will be needed as you advance on your defined goals. When you are ready to submit your application, use the online form on the Citizen CPR Foundation website. You will find the form to be easy to use, and you will use that form in answering specific questions and uploading supporting documentation and related files in a digital format. This is your opportunity to brag about your achievements. Be certain to provide as much supporting documentation as possible. By doing so, the review process can be as efficient as possible. Additionally, in the event that more work is needed, the foundation will be in a position to provide meaningful guidance to you and your community. Once an application has been completed and submitted, the Citizen CPR Foundation is automatically notified. After a brief review of the application, it is forwarded to 3 Program Advisory Committee members for a comprehensive and objective review. This review is typically completed within 3 to 5 days. If the review by the 3 Program Advisory Committee members is favorable, the application is shared with the entire Program Advisory Committee for a vote of ready for designation or not yet ready for designation. Those receiving approval will be notified by email and provided with a certificate suitable for framing, a press kit, and information relating to obtaining traffic grade HEARTSafe signs to be posted at key entry points to your community. Be proud of your achievements. Let your residents and visitors know by placing your HeartSafe signs at entry points to your community. A HeartSafe designated community receives a 3-year recognition. Renewal criteria is being drafted at this time. We anticipate that renewal will require maintenance of initial criteria and likely some additional goals. Any additional goals will be based on current resuscitation science, guidelines, and best practices. In those cases where a community is encountering significant barriers or have received a not yet ready for designation response, we offer assistance in the form of a coach from the Program Advisory Committee. The role of the coach is to provide a lifeline for the applicant and to provide recommendations and guidance aimed at helping the community to meet or exceed the established benchmarks required for designation. I hope you found this podcast useful. The journey to improved outcomes begins with a single step, and I encourage you to take that step with the Citizen CPR Foundation. I know you have questions, and we all hope to hear about your interest, those questions, challenges, and successes. On behalf of the Citizen CPR Foundation and the Program Advisory Panel, we wish you the very best in your quest to help people live longer and healthier lives. Thank you.